passed by the 111th Congress. Now, I know my colleagues on the other side of the aisle and many of their supporters in the mainstream press don't like us to use that term, but let me defend it for a moment. When you order every American to buy health insurance, whether they want it or need it or not, that's a government takeover of health care. When you order almost every business to provide government-approved health insurance or pay higher taxes and send their employees to government-run health exchange programs, that's a government takeover of health care. When you pass legislation that makes it all run with hundreds of billions of dollars in higher taxes, mandates, bureaucracies, and even public funding of abortion against the wills of the overwhelming majority of the American people, that's a government takeover of health care, and the American people know it. Now, last year, House Republicans pledged that if the American people gave us a second chance to lead this Congress, we would repeal and replace their health care reform with health care reform that focuses on lowering the cost of health insurance without growing the size of government. And we're keeping that promise today. Now, some in the cynical political class are saying this is a gimmick. It's an empty gesture. Well, we have another term for it on our side of the aisle. It's a promise kept. And House Republicans are here to stand with the American people and say with one voice, we can do better. We can do better than their government takeover of health care. We can pass legislation that'll be market-based, patient-centered, but it all begins with today. So I urge my colleagues to join us in repealing this government takeover of health care before it ever takes effect, and then work with us as we build health care reform that is worthy of the American people.
Gentleman yields back. Gentleman from California.
I yield 30 seconds to the gentleman from New Jersey.
Speaker, I wanted to explore one of the aspects of this repeal promise that's being kept. Thus far, there are hundreds of thousands of seniors who've gotten $250 rebate checks to help them pay for prescription drugs. I would ask anyone on the other side, what does the legislation say about whether or not the seniors will have to repay those checks to the government? I would yield to anyone who could answer.
Gentleman's time's expired. Gentleman from California.
To the gentleman from New Jersey, Mr. Payne.
Was that 1.5 minutes?
1.5 minutes, yes.
Gentleman's recognized for 1.5 minutes. Without objection.
Mr. Speaker, I rise in strong opposition to the Patients' Rights Repeal Act. Proponents of this bill contend that the current health law will destroy jobs, but CBO estimates that $230 billion support the fact that it is the repeal being debated today, not the health care law that would harm jobs and drain funds from potential job-building appropriations. Essentially, that is being repealed, and the protections afforded to taxpayers through the recently enacted health care legislation, the relief given to the American taxpayers who were for so long paying the bills for uncompensated health care, which we never hear mentioned over there, and the progress our country made last year to come out of the dark ages as one of the only 3 developed countries in the world that do not provide universal health care. 4,800 seniors in my district and over 1 million seniors in the country were relieved last year by the donut hole rebate, but repeal would reintroduce that stress. Nearly 44% of elderly constituents in New Jersey and 134 million Americans nationwide have pre-existing conditions. Repeal would reintroduce the hopelessness that Americans felt in the past as health coverage denied and stole their ability to access to quality health care. Repeal would remove nearly 1.2 million young adults from their parents' health care, including my grandson, who's 23 and is on his mother's plan, and remove their ability to take preventive measures now to avoid becoming a burden to the health care system. I urge defeat of this bill.
Gentleman from Minnesota.
Yeah, thank you, Mr. Speaker. Before I yield to the gentleman from Pennsylvania, I take about 10 seconds to respond to my friend, the gentleman from New Jersey, about the $250. It's not contemplated in the legislation, nor is it our understanding the scoring that there's any intention of that $250 being clawed back.
Will the gentleman yield?
I will yield now to the 2 minutes to the gentleman from Pennsylvania, Mr. Thompson.
Gentleman from Pennsylvania is recognized for 2 minutes.
Mr. Speaker, request unanimous consent to revise and extend.
Without objection.
Thank you. Mr. Speaker, as a healthcare professional for almost 30 years, I actually sat down and read all 2,000 pages of the healthcare bill. And as I read through the measure, I became increasingly alarmed at the level of control over an individual's health that would be vested in the federal government. I've spent my life working with those facing life-altering disabilities and diseases. And I've been quick to point out that while we have the best health system in the world, there must be improvements. That is why I'm supporting the repeal of the Patient Protection and Affordable Care Act. And I believe there are plenty of reasons for my colleagues to join me. The law mandates purchase of a government-defined insurance plan, a mandate that the President opposed on several occasions when running for office. As a result, on failing to live up to this promise, the Justice Department is now attempting to defend the mandate on the grounds that it is a tax. According to the nonpartisan Medicare actuary, because of the law, national spending will increase by more than $310 billion over the first 10 years. The law will not lower health care costs despite numerous claims that we've heard. According to the Congressional Budget Office analysis, health insurance premiums could rise by an average of $2,100 per family. This increase comes despite promises of lower premiums. Mr. Speaker, if this law remains in place, up to 35 million people could lose health care access. According to the former CBO budget director, the health care law, quote, provides strong incentives for employers with the agreement of their employees to drop employer-sponsored health insurance for as many as 35 million Americans. The National Taxpayer Advocate issued a report that suggests 40 million businesses will be impacted by the new IRS 1099 filing requirements. This will require vendors and small businesses to do paperwork on any transaction over $600. In addition, the Taxpayer Advocate does not believe that this will result in improved tax compliance. This provision is so unrealistic that even the President's small business administrators called for its repeal. Mr. Speaker, we must repeal and replace this law and continue together as the entire Congress, not just two parties, and move forward with the common sense ideas that will include better access, affordability, quality, and promote patient choice. I encourage my colleagues to join me and vote for repeal.
The gentleman from California.
I yield 1 minute to the gentleman, Mr. Cohn.
The gentleman is recognized for 1 minute.
Thank you, sir. I'm going to cite two Republicans who give good reasons to oppose this legislation and keep health care reform. One of the new Republicans, when he didn't think he was going to get his insurance immediately, said, "What am I, not supposed to have health care? It's a practicality. I'm not going to become a burden for the state because I don't have health care, and God forbid I get into an accident and I can't afford the operation. That can happen to anyone." He succinctly summed up the reason why everyone should have the same opportunities as members of Congress have to have health care. But more importantly, in a more intentional way, one of the most revered doctors in the world, former Republican Majority Leader, Senator Bill Frist, said yesterday that he urged the Republicans to drop the charade and build on the legislation. He said if he would have been here, he'd have voted for the bill, and it was important to consider the bill the law of the land and move from there. It is the platform, the fundamental platform upon which all future efforts to make the system better for the patient and the family will be based, and that is a fact. It has strong elements.
Time's expired.
I support Dr. Frist.
Gentleman from Minnesota.
Thank you, Mr. Speaker. I'm pleased now to yield 1 minute to a member of the committee, the gentleman from Pennsylvania, Mr. Platts.
Gentleman from Pennsylvania is recognized for 1 minute.
Thank you, Mr. Speaker. I appreciate the gentleman yielding. I rise today in support of House Bill 2. This simple two-page bill seeks to repeal the new unconstitutional health care law that will create a massive new entitlement program, cost taxpayers more than $2 trillion per decade, increase taxes and impose job-destroying mandates on businesses, cut Medicare by hundreds of billions of dollars, and further increase health care premiums for individuals by more than 10%. The goal is not only to repeal the new health care law, but also to replace it with real reforms debated openly through the ordinary legislative process that are truly about reducing health care costs. Reforms such as allowing small businesses and individuals to join together in national group plans to cut premium costs, allowing individuals to purchase health insurance across state lines, thereby increasing competition for their businesses, and enacting medical malpractice liability reform legislation. I will continue to push for common sense reforms that are focused on truly reducing health care costs for all Americans. I urge my colleagues to support H.R. 2.
Gentleman's time is expired.
First time. Yield
Gentleman
back.
from California.
I yield 1 minute to the gentleman from Michigan, Mr. Peters.
Gentleman from Michigan is recognized for 1 minute.
Mr. Speaker, with unemployment in Michigan at over 12%, I'm not going to support a bill that raises taxes on small businesses. Let us be clear. Voting for the Patient Rights Repeal Act will eliminate the small business health care tax credit. Small businesses have faced outrageous increases in their health care costs over the past decade. This tax credit helps reduce that burden and is already making a real difference. The LA Times reported that small businesses are signing up for health care coverage for their employees despite the bad economy since the tax credit took effect. Among firms with 3 to 9 employees, there has been a 46% increase in the number offering health benefits. But this bill would put a stop to that. The Detroit News reported that last week that more than 126,000 small businesses in Michigan would lose the tax credit under this bill. The last thing that small businesses in Michigan and across the country need right now is higher taxes. But that's exactly what this bill would deliver. Mr. Speaker, I urge my colleagues to vote no and join me in standing up for our small businesses.
Back. Gentleman from Minnesota.
Thank you, Mr. Speaker. At this time, I'm pleased to yield 1 minute to a new member of the committee, the gentleman from Pennsylvania, Mr. Barletta.
Gentleman from Pennsylvania is recognized for 1 minute.
I thank the chairman for yielding. Mr. Speaker, I rise today in support of repealing the health care law. I believe everyone should have access to affordable, quality health care. However, the law passed last year does the contrary. It makes health care less affordable. It diminishes the quality of care. It forces seniors out of their Medicare drug coverage, and it prevents small businesses from getting Americans back to work. In my district, we have the highest number of seniors in Pennsylvania, and the $206 billion in cuts in Medicare Advantage will cause 7.5 million seniors to lose their retiree drug coverage by 2016. Small businesses face a $2,000 fine per employee if their plans do not meet a bureaucrat-approved standard. At a time when the unemployment level in my district is over 9%, Congress must not discourage job creation by placing mandates and levying penalties on those who will get us back on track towards a more prosperous nation. I urge my colleagues to vote yes on H.R. 2, and I yield back the balance of my time.
Gentleman yields back. Gentleman from California.
I yield the 1.5 minutes to the gentleman from Oregon, Mr. Wu.
Gentleman from Oregon is recognized for 1.5 minutes.
Thank you, Mr. Speaker. While America desperately wants more and better jobs, Washington Republicans want to waste time today debating a health care repeal charade. But let's look at what health care reform repeal would actually do. In my congressional district alone, repealing this law would allow insurance companies to deny coverage for up to 360,000 individuals with pre-existing conditions, including up to 45,000 children. Let's mend this act, don't end it. A repeal would eliminate health care tax credits for up to 19,000 small businesses and 164,000 families. Mend it, don't end it. A repeal would eliminate new health care coverage options for 3,100 uninsured young adults. It is time to mend it and not to end it. In 50 years, Mr. Speaker, health care reform will stand beside Social Security, the GI Bill, and Medicare as a pillar of American health care and humane values. The people of that time will not understand why it was hard to pass in the first place or why we are spending time today rehashing old business. It's time to fix health care reform's remaining deficits and to mend it and not to end it. I yield back the balance of my time.
If I may inquire.
State your inquiry.
How much time is available on both sides?
Gentleman from California has 8.5 minutes. Gentleman from Minnesota has 15 minutes. Gentleman from Minnesota is recognized.
Thank you, Mr. Speaker. At this time, I'm pleased to yield 1 minute to another new member of the committee, the gentleman from Pennsylvania, Mr. Kelly.
Gentleman is recognized.
I thank the gentleman for yielding time. Mr. Speaker, last week Federal Reserve Chairman Ben Bernanke said, well, the overreaching and burdensome requirements of Obamacare will hurt small businesses, and their benefits are not even certain. Small companies, which account for over half the private sector economy, are more likely to struggle than survive under this law. If I had followed the plan prescribed for my dealership after the takeover, the government takeover of General Motors, I would have lost the business that my father started 57 years ago. We need to address the years of hard work and the spirit of entrepreneurship that will be destroyed under this law. Small employers have limited autonomy under Obamacare. The federal government is dictating what benefits they must offer and then punishing them for expanding their operations or paying their people more. The choices for small business under Obamacare are provide government mandated